In this lesson, we will continue our in-depth analysis of common non-communicable disease (NCD) risk factors, intersectionality, and compounding effects. NCD risk factors frequently co-occur, and their combined presence multiplies disease risk, e.g., smoking plus obesity dramatically increases the risk of 395, diabetes, and cancer compared to either factor alone. Social determinants such as poverty, education, and urbanization further amplify risk and drive disparities. Now I will talk a bit about social determinants and vulnerable populations. Poverty, education, and urbanization are major drivers of NCD risk factor prevalence. Lower socioeconomic status is linked to higher exposure to unhealthy diets, tobacco, and limited healthcare access. Vulnerable groups, low and middle-income countries bear disproportionate burdens. Gender and regional disparities exist, with men generally at higher risk for 395, but women more affected by certain NCDs in some regions. Urbanization increases exposure to processed foods, sedentary lifestyles, and air pollution. Policy frameworks and global strategies whose Global Action Plan for NCDs 2013-2030 provides a roadmap for reducing NCD risk factors and premature mortality, emphasizing multi-sectoral action, risk factor reduction, and health system strengthening. Sustainable Development Goals (SDG 3.4) calls for a one-third reduction in premature NCD mortality by 2030 through national initiatives. Many countries have adopted strategies focusing on tobacco control, obesity prevention, and improved access to care. Aligned with WHO recommendations, key non-communicable disease (NCD) risk factors continue to have a significant global impact on health. Smoking, with a prevalence of 22.3% among adults in 2020 and over 8 million deaths annually, is strongly associated with lung cancer, Colorado PD cardiovascular disease, 395, and stroke. With interventions such as nicotine replacement therapy (NRT), pharmacotherapy, and policy measures like MAUR being critical. Obesity, affecting 16% of adults as of 2022 and rising, is linked to diabetes, hypertension, 395, and cancers, with interventions including lifestyle changes, pharmacotherapy, and surgery, while screening tools like BMI and waist circumference are commonly used. Physical inactivity, affecting 27.5% of adults in 2016, contributes to diabetes, 395, cancers, and increased mortality, with solutions ranging from exercise guidelines to enhancing the built environment. An unhealthy diet is a widespread issue globally, linked to conditions such as 395, diabetes, obesity, and cancer, where interventions include dietary counseling and public health policies, often measured using tools like the Healthy Eating Index, HEY, or DASH Mediterranean scores. Finally, alcohol use, causing 2.6 million deaths annually, is associated with liver disease, cancer, 395, and neurological disorders, and can be addressed through brief interventions and pharmacotherapy, with screening tools like Audit and Audit-C aiding in early detection. These risk factors emphasize the value of preventive measures, lifestyle modifications, and public health strategies in reducing the global burden of NCDs. Smoking, obesity, physical inactivity, unhealthy diets, and alcohol use are the principal modifiable risk factors fueling the global NCD epidemic. Social determinants compound their effects and often intersect within individuals and communities, amplifying disease risk and health inequities. Comprehensive, evidence-based interventions spanning clinical care, public health, and policy are essential to curb the NCD burden and achieve global health targets.